Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. This is your host, Dr. Jason Jones, and today what we're going to talk about is what is insulin resistance and what are the signs and symptoms of it. Now, insulin resistance is estimated to affect 1 in 3 Americans. This silent blood sugar problem increases the risk of having prediabetes and type 2 diabetes, as well as other serious health ailments such as cancer, stroke, and heart attack, which they've all been tied to. We also know that insulin resistance, being obese, it ties to sort of like, all-cause mortality, or basically your risk of dying of a health problem that is related to insulin resistance and trouble with your controlling your blood sugar. So insulin resistance occurs when the muscle cells, the liver, and body fat don't respond well to insulin due to an excess amount of sugar or glucose in the bloodstream. This reduces the ability of the cells to absorb that sugar as a source of energy. However, the pancreas can produce high amounts of insulin that can overcome the low rate of absorption. Your blood sugar will remain in a healthy range, and you'll be less likely to develop problems because of it. However, it does come with a whole host of consequences if that goes on long enough, because you may not notice any of the symptoms of insulin resistance until diabetes develops. And research shows that 90% of people living with pre-diabetes don't know they actually have it. That's why you'll need to take a blood test to determine your blood sugar levels. And on top of that, you may not know that you're suffering from other conditions associated with insulin resistance, including low good cholesterol levels, high blood pressure, high triglycerides, without seeing your doctor, because oftentimes they're just quite silent, just like most health problems are. However, some of the common signs of insulin resistance go like this: blood pressure readings that are higher than 130/80, a fasting triglyceride level over 100, a waistline that is 35 inches for women and 40 inches or more for men, an HDL cholesterol level below 50 in women and below 40 in men, fasting glucose levels over 100, and patches of dark velvety skin. In addition to that, also skin tags. Now, insulin resistance can worsen the symptoms of things like PCOS, or polycystic ovary syndrome, which can lead to infertility and irregular menstrual cycles and periods that come with chronic pains. Doctors also record that high levels of insulin in the blood is associated with an increased risk of vascular and cardiovascular or heart disease, even when you don't have diabetes. So what are the risk factors for insulin resistance? Well, insulin resistance, prediabetes, and diabetes are often associated with the following risk: high blood pressure, obesity, or being overweight, especially when you have extra weight around your midriff. So here's the thing. When your waistline is bigger than your hips, you are in trouble. So measure around the center circumference of your butt and measure around the biggest part of your waist. And if your waist is bigger than your rear end is, or your hips are, you are in trouble. I don't care if you have symptoms or not. You got to understand, you are in trouble, and you need to get that down. Sleep issues are another one, lack of exercise or sedentary lifestyle for sure. And of course, we all know smoking. And you can just look at smoking as one of those things, and people say, well, smoking, it's related to the lungs, it's related to this, it's related to that. Smoking is terrible for everything. You just got to understand that. Some risk factors that are common for diabetes, heart disease, and even cerebrovascular health issues, like basically brain vascular issues, such as like a stroke. So lifestyle changes can help reduce the risk of developing some of these conditions, such as obesity. Now, how to prevent insulin resistance? So you may not be able to influence some of the factors of insulin resistance. Maybe you have like a genetic predisposition or a family history, and I'm going to go out on a limb here and say that those are most likely a extremely small percentage. But here's the thing: even if you can't control something, you just focus on the things that you can control and just do those, and then just let the consequences fall where they may. You may have to take some extra measures to reduce your chances of becoming insulin resistant. And one good measure, again, follow an active, healthy lifestyle. The more that your muscles become sensitive to insulin when you exercise, the better you're going to be. So you might try to increase your physical activity gradually, work on altering the diet. Maybe you need to go low carb. Maybe you just need to play with your carbohydrates and see which one is going to work for you. Because low carb isn't for everybody, but for a lot of people, this really helps them out tremendously. So I hope this helped you. Any questions about it, go to our Facebook page, Dr. Jason Jones, Health Made Easy, and we will help you out with any questions on there, and we'll see you guys on the next podcast. Bye-bye.